Hi, I'm Rachel from Rachel's Fitness for Mums. This little video is for pregnancy, but it can also be for postnatal. But we're just going to take it back to the basics and focus on our breathing. So you can do this sitting down on the floor. If you've got a ball, a stability ball, you can sit on that. If you've had that during your pregnancy and you've still got it kicking around postnatally, sit on your ball and you can do it. Or you can do it sitting on a chair. But we're just going to focus on the breath. It's just going to be a short video just to really focus you on your breathing with your connection of the abdominals and that all-important pelvic floor lift. So if we put our hands onto our rib cage and we're going to take a big deep breath in, widening the rib cage, and then as we breathe out, we're going to breathe out to the end of the breath until we can't breathe out anymore. So it's a forced breath out. Breathe into it, inhale. Feel the rib cage expanding, and then as you breathe out, forcing the air out of our mouth, feeling something starting to connect here through the core, breathing in to expand. So if you are pregnant, we're allowing baby to have that room and movement as we breathe in, and then as we breathe out, we're hugging baby in towards you. So we're really working the muscles around your bum to bring baby in towards you. This is your transverse abdominis muscle, remember, which wraps around here, which is the muscle that keeps our baby held in, helps to push baby out, and it also helps to protect our back. So for those mums that are experiencing a little bit of lower back pain because they're now in the last few weeks of pregnancy, this muscle, this transverse muscle, if it can keep it strong, then it'll help to prevent that lower backache. So using that breath to try and engage the core, so engaging your abdominals to bring baby in towards you. But like I said, it can be for postnatal as well. So again, we take a breath in, we breathe out, forcing the air out of the mouth. It's a forced exhalation which really starts to connect with these abdominals. Try not to cave in through your upper body. Try and keep nice and upright as we breathe out, and just really focusing on that big muscle, that core corset muscle, drawing in as we breathe out. And then we breathe in again to expand and let everything relax. And then as we breathe out, pushing the air out of the mouth and feeling that muscle working around there. Okay, then we breathe in and we just do nothing for a little while if you want to do some upper body circles, and then we'll start to think about the pelvic floor. So postnatal mums, you're probably feeling now pelvic floor does not work, it's not there, reverse that circle, but we need to get that brain to pelvic floor connection again, so we will keep working on it. Pregnant mums, you hopefully still feel that you can get your pelvic floor lifted, especially the girls that are coming to my classes, but through the third trimester, it feels a bit heavy that you've got this weight bearing down on you, your baby. So it is like weight training your pelvic floor in those last few weeks and months. Okay, so we take a breath in, again, nice and wide and deep. As we breathe out, we push the air out of the mouth, drawing the navel towards the spine, so baby in towards you, and then we try and lift up pelvic floor as we breathe out. Then we breathe in, and we just let it go, completely relax. And then again, we breathe out. So we're using the abdominals as we breathe out. We're trying to lift up pelvic floor as we breathe out. And then we breathe in to release and relax. And again, breathing out. So we're drawing baby in. We're lifting up the pelvic floor. Squeeze, squeeze, squeeze. Breathing in to release and relax. Remember to completely let go of the pelvic floor once we've taken our breath in. And then breathe out. Forcing the air out, lifting up, so it's muscles coming up and coming in towards baby, breathing in to release. One more before we all go dizzy. Breathing out, drawing baby in, lifting that pelvic floor up, breathing in to release and relax. Just take a few normal breaths. So your pelvic floor muscle, remember it's that muscle that, it's the feeling of tightening up your vagina or your front passage or your back passage, and then lifting up inside the pelvis. You can do that little test when you're on the toilet, you're in the middle of going to the toilet, you can hold that, stop the flow of urine coming out. Only do it once though, because that can give you an infection, so you don't want to do that every day. But that is the feeling, that will give you the feeling of what your pelvic floor is or how you need to contract it. So as you're sitting and doing your pelvic floor, that is the feeling of closing up those three passages and lifting up inside. Once it's up, we slowly release it back down so it's completely relaxed, and we're not keeping it tight and tense. We're relaxing it to then do another repetition, so breathing out to lift. Okay, so there's a little bit of your pelvic floor and your transverse muscle and the breathing. So a little video for you to do again at home. I'll see you on the next one. Thanks, bye.